Good morning and welcome to the webinar. My name is Lauren and I am the Educational Services Manager here at Alzheimer's Orange County, and I will be your host today. Thank you for joining us for our webinar on sleep apnea. Today, our presenter is Dr. Neal H. Patel. Before we begin, just a few friendly reminders. We will not be offering CE credits for this webinar. The handout was sent to you via email. If you need another copy, please email me. I will put my information in the chat box. And any questions that you have for the presenter, please type into the chat box located in the taskbar. We will save your questions and answer them at the conclusion of our webinar. And lastly, that we please ask you to complete the survey at the end of the webinar as you exit, as it helps us to continuously improve our webinars and lets us know what you would like to learn about in the future. So quickly, I'll introduce Dr. Patel and then I'll hand it off to him. Dr. Patel is a family medicine physician currently in private practice in the city of Orange. He was born and raised in Orange County and completed his medical school and residency in Southern California. He believes in the quality of medical care versus the quantity and approaches medicine in a holistic manner. Patient care has always been his top priority, and he continually strives to provide it at the highest level. So Dr. Patel, I will now hand it over to you.
Okay, hi everybody. Good morning. Hopefully, can you hear me? Hopefully, can you hear me all right?
Yes.
Okay, great. Well, thank you so much for that introduction, Lauren. My name is Neal Patel, as she mentioned. I'm currently a doctor here in private practice in the city of Orange. So today we're going to talk a little bit about sleep stress. So who here seems to be working a lot? I know Thanksgiving's around the corner, but who here still got a lot to do? Who here tends to not prioritize their sleep? Okay. Let's see. All right. Well, who here's life is like this? So with today's lifestyle, we tend to discredit sleep and work on work and stress. So today we hope to kind of touch on a few of these things that can affect your sleep. I don't know how you felt like this. I felt like this plenty of times in my life, sometimes after getting up. So it's kind of that feeling. I'd like to start with a quote. Sleep is the best meditation by the Dalai Lama. Do you ever wonder what is sleep, right? What is the actual definition? So sleep is actually the noun from Cambridge University. It's the resting state where the body is not active. So that's key. Body is not active and the mind is unconscious. Just like a verb, it is the state of being not active for your body and your mind being unconscious. Let's talk a little bit about the history of sleep. So sleep has been, I guess, created since the beginning of mankind or creation itself. Almost all creatures sleep. History of sleep, a lot of ancient cultures, including Indians, Egyptians, did have gods named after them. For example, in Greece, Hypnos was a Greek god of sleep, right? Hypnotherapy. In Roman times, it was somnus. That's why somnolence comes from that word. And then Indians, they call it ratru. And then Egyptians had nut. If you look carefully, 400 BC here, Aristotle believes that sleep was an arrest in the heart. So arrest of consciousness in the heart. All the way to 162, Claudius Galen, he was a Greek physician. He identified the brain being the seat of consciousness. And look at this big gap. From 162 AD all the way to 1913, seems like there was not much that was done in terms of sleep. Until 1913, Henry Pierron, he tried to explain the science of sleep. 1925, Nathaniel Kleitman discovers REM sleep. He was a sleep psychologist. In 1965, sleep apnea is the diagnosis is created. In 1980s, the connection between what we call the circadian rhythm and sleep is determined. And what have we discovered today? Well, we have discovered we are overworked, overstressed, and sleep deprived. We have lost a lot of sleep trying to learn how to get better sleep and get more sleep. So you ever wonder why is sleep important? Or do you usually just say, yeah, it's okay, I'll sleep tomorrow. Well, I'll make it up for tomorrow. Well, a lot of reasons. Number one, it strengthens your immune system, which we'll touch on. Obviously, it regulates your mood. It can help balance your mood. Helps you process information. We'll talk about how sleep can affect memory. Restores your body physically. You tend to make healthier, smarter choices when you're rested, and it reduces your risk of certain medical conditions. Look how many different, this is just a small list, but just central in terms of your memory, your brain. You can have cognitive impairment, ADHD, even some moral judgment, right? You're not as inhibited. Your heart, you can have heart rate, irregular heart rate, heart disease, aching, you name it. So this is why sleep is so important. A lot of people tend to, if you were to choose, which one of these would you rather be? Homer Simpson or Ned Flanders? Well, there's so much study and so much data that's gone behind sleep. So it's a lot of research. Obviously, we would like to be more like Ned Flanders at this time. Sometimes with our lifestyles, it becomes more like Homer Simpson. Each night when I go to sleep, I die. And the next morning when I wake up, I am reborn. Gandhi. So you ever wonder what consists of sleep? We just talked about definition, but there's different parts of sleep. So anybody here know what non-rapid eye movement is, or non-REM sleep? Have you ever heard about that term? Okay. So let's go through it. So there's something called the non-rapid eye movement, which is this N1, N2, and N3 parts. Okay. Now, this is an overall sleep cycle. Usually one sleep cycle is about 90 to 110 minutes. All right. So 1.5 hours to about 2 hours. You usually recommend about 4 to 6 cycles. So this N1 through N3 makes up quite a big chunk of our sleep. 75% actually spent in that cycle. N1 is this little yellow part right there is considered light sleep. So, you know, when you're sitting there and you're just slowly drifting away into that sleep, that's the N1. You're still breathing fine. Muscles are working. It's short, lasts only 1 to 5 minutes. So you're looking at maybe 5% of your total time. Now, when you fast forward into deep sleep, look how big this chunk of the cycle is. N2 is what we call deeper sleep. Right? Everything starts to slow down, your heart rate, temperature, lasts about 25 minutes. Each cycle of your sleep, it increases. So you're looking at about 45% total. And then, of course, getting to the third stage, which is usually stage 4 is combined with stage 3, but this stage 3, which is deepest non-REM sleep, which is your deepest sleep. This is actually the most important, actually very crucial. It's hard to awake from. This is a time when your body regrows, tissues build, your immune system gets better. So that's why it's so important to get not only sleep, but that deep sleep. It can last about 20 to 40 minutes. So you're looking at about a quarter of that sleep cycle. Now, who here's heard of rapid eye movement? You ever heard about this? Okay, this is a little more, I think, more commonly known. These are different stages of sleep, like we mentioned. It's associated with dreaming. So when you're dreaming, that is actually not restful sleep. It's actually your body and your mind are actually processing a lot. It usually starts about 90 minutes, like we said. The first cycle is 10 minutes. It can go up to an hour. Interestingly enough, when you're in rapid eye movement, your brain is highly active. So your brain is using up 20% increased metabolism. You're kind of like you're awake in a sense. You're breathing faster, your blood pressure increases. Yet, this is so important for this reason. Helps your memory, emotional processing, and your brain. And we'll get to a little slide later about how kids sleep so much for a reason, because this is a time when they're developing a lot of their brain. So, has anybody ever seen this, or anybody know what this is? Okay, so I'll touch on this real quickly. Basically, in life, like light, for example, there's different frequencies, different wavelengths. Our brain works at different frequencies. Very interesting. Oops. And what it does, you have different parts. So when we're talking like this, we're in what we call beta waves. We're functioning, we're listening, we're absorbing. Now, when you get into that relaxed stage, you get into alpha waves. As you get deeper into sleep, you get into these theta wave, and then delta. Theta waves have also used for memory consolidation. Okay, so you have different levels and different frequencies. This is kind of what it looks like, right? Stage 2 REM sleep, non-REM sleep would look like this. Stage 3, you're like in delta wave. REM sleep, we don't really consider it because your wavelengths are all over. And this is interesting. So for Whoop is a type of fitness monitor system, and it can record different parts of your sleep. So it tells you when you're awake, these little white parts awake, REM sleep, your deep sleep, right, and your light sleep. So this is a great little tool for those who may want to track more detailed of their sleep. Okay. And this is what it looks like under the hood. So when you're in regular sleep, you're sleeping. But when you're in REM sleep, your eyes and your body is very, very active. So sleep disorders. So now we're going to get into some of the more common things, sleep apnea and insomnia. These will be the top two we focus on. Restless leg syndrome, I see that relatively frequently in my office. Narcolepsy, I rarely see in my office. Okay. Does anybody know about sleep apnea? Or you may have heard about this. Sleep apnea definition right here, one repeatedly stops and starts breathing. So you literally stop breathing. It's quite amazing. Usually the partner, loved one will notice that their person is not snoring or is snoring a lot, it's not breathing. A lot of episodes. Some people have 5, you can have up to 100. So it's quite a lot. More common in obese males, but it also increases once women approach menopause. Sleep apnea, if it's not diagnosed, can lead to heart disease, increases your risk for dementia. And when you're in sleep apnea, when it's not treated, you're reducing your time in that N3 non-REM sleep and REM. And if you remember, that is meant for helping heal your body, helping heal your mind, and processing your emotions. 39 million people, adults in America, have obstructive sleep apnea. And this is usually the first diagnosis. So the first person diagnosed with sleep apnea usually is the partner. Okay, this is what they come in with, wife or husband, feel frustrated. And there's different types of sleep apnea. The main one we're focusing is on number 1, OSA, or obstructive. This is an anatomical issue that's affecting your ability to breathe. Okay. Central is a whole different situation. I don't deal with central. This is strictly neurological. To make it maybe an analogy, imagine a garage door. So obstructive sleep apnea is when the garage door doesn't open or close, right? The actual door is not opening or closing. Central sleep apnea is when the entire garage door system is not even working. There's a complete disconnection with electricity. So it can be very deadly and it can be very important to get checked out. So let's look at this video real quickly.
It causes sleep apnea. These muscles provide support for the tonsils, the tongue, the soft palate, the uvula, the side walls of the throat, and the triangular piece of tissue that hangs from the soft palate. Your airway narrows or shuts as you inhale when the muscles relax. Your blood's oxygen level may decrease if you don't get enough air. When your brain detects that you are having trouble breathing, it abruptly wakes you up so that you can clear your air passages. This awakening is usually so brief that it is forgotten. Each hour throughout the night, this sequence may repeat itself 5 to 30 times or more.
Yeah, so if you notice, right, there's 2 different places where air enters, your nose and your mouth. So this little uvula, that's where it kind of cuts off. And then all of a sudden, you can't breathe. So your tongue kind of depresses, pushes against the uvula, then you create sleep apnea. So when it comes to, excuse me there. And when it comes to diagnosing, anybody ever have to take a sleep study in their life? Yeah, I have not, but I've heard it's not the most comfortable and most natural. Long story short, a sleep study is what we use to diagnose it. You want to, there's different ways to do it, but you are connected to different equipment that checks every part of your body and make sure that you do qualify. Now, sometimes nowadays, a little more often, home sleep studies can be done. I wouldn't say it's as accurate, but is a good in between, especially if you're not comfortable going into a sleep study center. So these may be some questions you ask yourselves in the audience. If maybe you do have sleep apnea. If you're snoring, if you're tired, so if you or your loved one experience observed apnea, high blood pressure, BMI heavy, 50 or older, right? Neck circumference male. So if you add these up and you're over 4, I'd say then you may want to consider getting a sleep test. Like I said, this is kind of what it looks like. You have a room. If you go to a sleep center, they try to make it as comfortable as possible, make it like a hotel. But usually there's people observing you, watching you, and seeing how you do over the night. But look how many wires you have to put when you get a sleep study. All these different wires, and then they expect you to sleep. So it's a little uncomfortable, but all these wires do have a reason. You're trying to monitor as much data as possible. Okay, let's see if we can hear this. This is what sleep apnea actually sounds like. Okay, snoring already. Okay, stop right there. All right, stop breathing. Another episode, that's 2. Okay. Look how long he's not breathing. So if you think about that, if you notice during that, there were a lot of parts where there was complete silence, and that's apnea. So that person is not breathing. In this specific recording there, I think there was a part where it's like 10 to 15 seconds in a row, like consecutive seconds of not breathing. Imagine doing that multiple times an hour. So that's why it's so crucial to, be on top of this. I won't go over this too much, but this is what they're looking at. So all those wires pump out all this data. All these waves are important. It means you are obviously breathing. They check your oxygen levels. But look at that flat lining. All of those flat lining is when you are not breathing. This was started with 33 minutes, 45 seconds is 50. Yeah, this is quite a long amount. This is over like each one of these little green squares is about 5 seconds. So 5, 10, 15, 20, 25, 30, 30, 40 seconds. This patient is not breathing. So that's very concerning. And usually this is what it looks like in real life. It's a little busy slide, but we'll go over if you decide or do need to do a sleep study, what to expect. Obviously, you want to try not to drink if you do drink. Minimize caffeine, avoid naps. You want to try to make it as clean as possible. Like we said, you're going to be, a lot of sticky sensors, all these things can be placed on your skin. So it's important you shower. You try not to apply any hair products or oil or greasy things. It can affect the adhesion. You bring pajamas, try to pretend like you're going on a mini vacation maybe and get comfortable. Bring your comfy clothes, maybe a book or something to read. I get this question a lot. Doc, will I be able to drive home? Yes. You're not going to be under any medicines, no medications, no drugs. So you can drive yourself there and drive yourself back. Now everybody wants to know, how do you treat it? What do we do? Lifestyle, all right? If you're overweight, like that kind of questionnaire had, overweight, if you smoke, if you have high blood pressure, so you try to control the things we can. Nasal decongestion is not really. Maybe if you have allergies, this might help. CPAP machine. Anybody here heard of a CPAP machine? It's the most common type, right? And then we'll show you a video on this, which is a new type of device that can basically help keep your airway open. And these last 3 we'll go over those. They're a little not as effective. Most effective is a CPAP or BiPAP. But look at it. If you don't control your CPAP or sleep apnea, you can increase your risk of Alzheimer's, depression, stroke, diabetes, everything increases. And if you think about it, as humans, we spend approximately 30% of our lives sleeping. So that's why it's so important. So this top left corner, if you can see my arrow, this is Smart Nora. This is a device actually, which, see this little gray thing? You slide it under your pillow And this little microphone above your head actually detects you snoring. So when you're snoring, this little thing actually inflates to lift your head up, to elevate it a little bit. That helps to kind of maybe open the airway. You can buy this online or Amazon. Oral appliance is meant to push up that lower jaw. If you remember the video, it shows how the tongue depresses into your airway. This is another thing by Philips is meant to vibrate. You put on your chest. You could wear a backpack, force yourself to sleep on the side. I have some patients who keep a couple tennis balls in their bed, so they can't actually physically sleep on their back. Surgery, I usually do not recommend it. Maybe if you're a child, that's the only time. But as an adult, you really want to avoid surgeries if you can. So are you guys familiar with this or ever seen this? This is a CPAP machine. This is the most common types. Full face, it's ideal because it seals as much as you can with the airway, but it can be claustrophobic. It can be tough for patients to breathe like that for the, possibly the rest of their lives. They have other alternatives. There's one here that affects the nose and the mouth, then sometimes just the nose. Okay, the idea is it's better to have something and use and treat it than not to treat it at all. So let's take a look at this video.
Similarly, in people with OSA, the airway muscles relax too much. However, the airway narrowing is more significant than in snoring and causes a slight or full reduction in airflow to the lungs. When the airway is blocked, OSA sufferers will wake either partially or completely to breathe again. Continuous positive airway
That's
pressure,
CPAP.
CPAP, is the simplest and most effective treatment available for OSA. CPAP devices deliver a flow of air to the upper airway via a mask that seals the nose and or the mouth to create a positive airway pressure. This positive pressure provides a splint in the airway to prevent it from collapsing during sleep.
So that's the idea. It's literally continuous airway being pushed into your mouth to keep it open. So it can be kind of tough. Some patients experience it like you're talking or breathing into like the wind. So that's why you have to adjust how much wind or how much the airway pressure you need. So Inspire device, like we touched on, this is a new kind of alternative to the CPAP machine for those who can't, use it. It's approved by the FDA about 10 years ago. It's a procedure, so you do have to be put to sleep. They put this little pacemaker device right underneath your skin. The sensor on this side detects your breathing patterns, and the other sensor is like a stimulation. Literally zaps your tongue muscle to kind of open anytime it does not recognize your breathing. That's kind of what it is. Let's just take a look.
Inspired therapy is the only FDA-approved device known to help patients with obstructive sleep apnea who are unable to use CPAP. The device is implanted in the chest wall just like a pacemaker. When sleeping, the device is turned on and constantly monitors for any breathing attempts via a sensor attached to the chest wall. When a breath is detected, the device sends an electrical pulse to the hypoglossal nerve, which in turn stimulates the tongue muscle to move forward, resulting in a more open airway. Without such stimulation, the back of the tongue collapses against the throat's back wall, causing airway obstruction, resulting in sleep apnea. The device is implanted in the body via 3 surgical incisions in a same-day outpatient procedure. While asleep, the Inspired device continuously monitors breathing. Every time a breath is taken, an electrical pulse moves the tongue out of the way, allowing for clear breathing without obstruction.
Yeah, this is pretty cool. Very cool device. Like I said, I try to avoid any surgeries, if we can, or any procedures. But if for somebody who cannot handle like a CPAP machine, this is a great alternative.
Inspired.
Okay. So long story short, you're basically cutting off their airway and cutting off oxygen to your lungs and your body. So for those who are concerned they may have it or a loved one they know, there's some couple of great resources. American Academy of Sleep Medicine, and then of course sleepapnea.org. So we're going to kind of shift into next part. I love sleep. My life has a tendency to fall apart when I'm awake, Ernest Hemingway. Anybody ever feel like this? Okay. Is this how you are? This looks like me from time to time. So insomnia. Anybody here heard of insomnia? Suffer from insomnia? Take something for insomnia? All right. It's a very common sleep disorder. It's the inability to initiate or maintain sleep. Basically, you have a hard time going to sleep, hard time staying asleep. Most average adults need 7 to 8 hours. Interestingly enough, $63 billion lost in work performance due to insomnia. 40,000 driving accidents or injuries are caused by drowsy driving. So that's pretty concerning. In a hospital, people do make medical errors. They found that a significant portion of maybe about 100,000 hospital deaths can be attributed to sleep deprivation. So this affects not only us as an individual, but it can affect society. This is a little bit older. I was trying to find a newer slide. I couldn't, but this is from 2014 showing insomnia and how we look in the US. For some reason, the East Coast tends to get more sleep. I don't know if it's just the sports they're watching later for all the West Coast games. But if you look here, it's clearly red. So this was 10 years ago. With technology advancing, more people are on their phones. Good chance this might be even more red. California overall is decent. It seems like we're pretty relaxed. Nevada, interestingly enough, a little bit higher. What causes insomnia? There's so many things. If it's a new problem, you may want to look at, is there a change in your climate, temperature change? Did you have a new job, school, new environment, jet lag? But for those who suffer for a long time, you may want to ask yourself these other questions. Do you think you may have acid reflux? Do you have any anxiety or depression? Pain can clearly affect sleep in a lot of ways. Caffeine, alcohol, so those things people say, oh, I drink it in the morning, or I only drink like one beer here and there. Well, those small things can affect you overall. And of course, medicines, you want to talk to your doctor, or you talk to me as well if your medications are affecting your sleep. But sleep, is it important, or would we rather just drink the coffee until we get the job done? All right. So we talked a little bit earlier, of course, again, insomnia, sleep apnea, sleep in general affects your mood, immune system, low sex drive, poor balance, can affect everything. So how do you treat it, right? Same kind of concepts. There's lifestyle changes we'll go over the counter and prescriptions. So improve your sleep hygiene. In your room, it should be cold, quiet, and dark. So those are the top three: cold, quiet, and dark. So like we talked about earlier, prioritize sleep. Make it an intention to sleep. Right? A lot of times you may get caught up in your work or whatever you're doing and say, oh, I'll sleep in a little bit. And that turns into an hour later, 2 hours. Then you might get affected later. Have a nighttime routine, right? Brush your teeth, meditate, wind down. The bed is only for sleep and sex. I have patients, they watch TV in bed, they eat in bed, and then it confuses your body. Exercise is huge. You want to try to reduce how much devices, electronics you use. I usually tell patients about 30 to 40 minutes after or before you sleep, try not to use any electronics. And then daylight can definitely help your circadian rhythm and kind of adjust it. But what if that doesn't work? Well, that's why we got medications and supplements. This is a very common question I get asked. I cannot sleep. What do I take? So there's a whole bunch of stuff over the counter I prefer. Now, melatonin is pretty common. The average dose they say is 5 to 15, but studies show if you take over 3 to maybe 5 milligrams, your brain will actually stop producing its own melatonin. Right? So our bodies are smart and lazy. Most of the time, our body says, and our mind says, why do I have to work? I'll just wait for the medicine to work. So if you're going to take melatonin, I'd say start at the lowest dose, 5 milligrams. Suntheanine, anybody heard about this one? Or L-theanine? So Anybody drink green tea, right? So for those that drink green tea, excuse me, L-theanine is an amino acid and it's meant to relax you. So those why those that drink green tea tend to be more calm. Of course, teas in general, chamomile, valerian root. Now, binaural beats, this is very interesting. If you remember earlier, we talked about different wavelengths that our brain functions in. So imagine there's a way to fool your brain into a certain wavelength. Do you think that's possible? Well, with technology, yes. If you YouTube binaural beats for sleep or alpha theta waves, you can put in headphones and listen to like, it's just beats. It's not music. It's not anybody singing. It's just this like boo, 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 like a pulsing sound. And it can actually kind of put your brain into a different wavelength and help you sleep. I've tried it personally. I've had some patients who've tried it as well. Magnesium glycinate is used actually for restless leg syndrome and for cramping. Personally, when patients ask me what supplement, I usually like these two, magnesium glycinate or sleep 3. Unisom, that's not as commonly used, works on antihistamines. And then cannabis. Cannabis has becoming more popular over time. For those who do, I have quite a few patients actually starting to get into cannabis. So I tell them CBD or CBN, which is specifically kind of for sleep. It's totally fine. I'm okay with it. Usually start at a lower dose, maybe 5 milligrams, and then see how you do. So like I said, these are just a few that I like. I like this company, Sports Research. It's called L-theanine. It's a great one. Unisom we talked about. Buddha teas are usually pretty good. Like I said, most melatonins are higher, 10, 15, 20. You may want to try, even this one's 10 milligrams, but I think the combination with melatonin and it has L-theanine does help. And then prescriptions. Who here has ever been prescribed medicine for sleep? Right? Any of these sound familiar? Trazodone? Have you heard of Xanax, Valium? Anybody heard of Ambien? Right? So these are pretty common ones. If you notice, I did block these out real quickly. Doxepin, Trazodone is a pretty common one that I prescribe. Most patients do well. Unfortunately, a lot of patients think benzodiazepines or things like Xanax are for sleep. Technically, it's not for sleep. Now, what happens is once you start taking it for sleep, your body gets used to it for sleep, right? You tend to start needing it. To make it clear, Xanax is basically alcohol in a pill. So if you think about I have some patients, they take a drink at night to get them to wind down. This is basically the same concept. But the same thing is once you start taking it, you now are hooked. Just like Ambien. I'm not opposed to prescribing this, but if I can avoid it, I will, because now you get used to taking it, okay? But the truth is, I would rather my patient sleep than to not sleep, because clearly we've seen all the issues, what happens. I love Seinfeld, and this is how our brains and our bodies tend to work sometimes. Okay. So who said nights were for sleep? Marilyn Monroe. So we talked a little bit about what sleep is, some of the major conditions that affect humans for sleep. Let's get into sleep and memory. So things change, right? As we age, we expect things to change. As we get older, we spend less time in what we call rapid eye movement, what we talked about. This is why people's memories, emotions may change as we age. Harder to fall asleep, harder to stay asleep. This part of the brain is called a hypothalamus, little organ, little part that sits underneath the main cortex. It's what we call our internal clock. Have you guys ever just woken up and be like, oh, I'm awake, all right? Or like, oh, I'm gonna set an alarm in my mind for 6 a.m. and then you wake up. That's usually your hypothalamus. It's kind of like the thermostat. Controls your temperature, your body's needs, hunger, fatigue, sleep. Within the hypothalamus, there's this little gland called the SCN, suprachiasmatic nucleus, that controls, remember, the circadian rhythm, sleep and wake. And that's where melatonin also is, that area is where melatonin is produced. That's why light is very important and to stimulate this area. So remember we talked when you're young and you're a baby, look how much time we spend sleeping, right? When you're a baby, usually babies sleeping, they wake up to feed and then they go back to sleep. Why is that? Well, during those first 5 years, look how much they are, creating those pathways, emotions, all the nerves are starting to form within their mind. That's why, excuse me, it's so important that babies get sleep, but also adults. Unfortunately, as we age, go through life, you can see how our REM sleep goes lower. Our non-REM sleep also kind of diminishes, and we just stay awake longer. So memory processing, right? We talked about how sleep, if you don't get enough sleep, you don't have enough time to create those pathways, okay? The non-REM sleep, it helps you learn for the next day. And that deep memory stage of sleep, it tends to get lower and lower. And once we hit our late 30s, interestingly enough, adults older than 60 had 70% loss of deep sleep compared to young adults. For sleep apnea, if it's not treated, you can actually have an increased risk of less semantic memories, which is your personal history. So they start kind of forgetting their own biography in a sense. So just like we study during the daytime and then we sleep to absorb it, our body is studying during the nighttime to absorb it. So if you're sick, the nighttime your body actually can absorb, study the virus, the bug, and improve itself. This is pretty cool. What is the connection between sleep and dementia? So beta amyloid is a type of plaque protein buildup in the brain that can cause inflammation. Imagine like it's kind of like trash. It's like you're throwing trash outside of your trash can. So now it starts to cause issues, right? So beta amyloid is considered a toxin. If you can't sleep, you cannot remove it. We talked about circadian rhythm, how that changes, right? You have dementia can damage that nucleus we talked about. Inflammation and stress, right? There's so many things when it comes to sleep: blood pressure, smoking, cigarettes, alcohol, drugs, anything. So anything that can cause inflammation can affect your sleep. Blood-brain barrier, right? There's a little door entrance between what can enter your brain and the rest of your blood. So when that starts to become a little more open door, you get things that shouldn't be there. So look at this. This is pretty cool. So this is actually the blood flow and what we call cerebrospinal fluid as we sleep. So it's literally pulsating as we sleep. So imagine this being like a power wash. Your brain is literally washing and kind of cleansing. It's like you're washing out all the gunk. So it's really great. So sleep and Alzheimer's, right? The connection is there. Toxins, excuse me, inflammation, beta amyloid we talked about. So very important for sleep. I want to play this real quickly. This is Dr. Jeff Iliff. He was part of discovering what they call a glymphatic system. Anybody ever hear about the lymphatic system? Right? That's kind of like your body's trash cans. That's meant to help clean out the junk. In your brain, they're called glial cells. So those are the trash cans in your brain. So let's take a look.
We injected fluorescent tracer into the CSF, or the fluid that surrounds the brain, and watched to see where it went. The fluid, as it moves down the artery, is able to move right into the brain tissue. As it moves into the brain tissue, eventually, if you look long enough, where it collects is at the other end, at veins, which are another part of the circulation. Once it reaches those veins, it's able to drain out of the brain along the outside of the veins. As the fluid sort of courses between those two, in along the arteries, through the tissue, out along the veins, that continuous flow sweeps along particles that are sitting in between the cells.
It's quite amazing. It's literally like imagine just sweeping your balcony. You're literally cleaning things out of your brain. Those little dots you saw were the beta amyloid plaque. So if you don't get enough sleep, it starts to build up. Okay, so after all that we talked about, do we as Americans think sleep apnea is serious and sleep in general? Well, yeah, I think we do. For those in general, all adults put it in a serious category. 21 was at 30. 50 plus 25, about 75%, right? And obviously, if you are diagnosed, it becomes more severe and more concerning. So people do take this seriously, and I also take it seriously as a doctor. Now, I want to get into some statistics to kind of close us out. Harvard study did a long-term study where they followed over about 3,000 people over 65. They found those who sleep under 5 hours were twice as likely to develop dementia. So it's quite important. Another study found 8,000 participants where they found a 30% increase in dementia if they sleep 6 or less hours once they're at the age of 50, 60, 70 compared to normal sleep. I want to touch on aging just because, it's a lot of our population is starting to get a little bit older around the world. So I want to get some stats on aging. Life only flows in one direction. It only goes one way. We're headed towards what we call the silver tsunami. Anybody hear about that term before? It's a silver wave almost for the National Council of Aging. At this time, 2022, 17% of the population is 65 and older. But 2050, almost 1 out of 4 people will be over 65. For AARP, every day in the US, 10,000 people turn 65. For the US Census, look at that. The older population grew from 2010 to 2020, the fastest rate since almost 1880. This is a very telling fact. Older adults are projected to outnumber children under 18 for the first time in US history in almost 10 or almost 9 years now. So we're going to have a lot of health, we're going to have to really think as a medical and as Americans, how are we going to take care of this situation? Because it will affect everybody. But ironically, we're not even the top. For a percentage of people over 65, Japan actually, almost 1 in 3 people there are over 65. So all eyes are on Japan at this time on how are they going to take care of their, citizens. So many countries at this time, over 20%, Hungary, Germany, Italy, Greece. So this is a worldwide, I would say almost an issue, worldwide, problem if we don't take care of it. US, we're at 16%. So let's get into some Alzheimer's stats, right? From the Alzheimer's Association in Alzheimer's Orange County. Alzheimer's was the 5th leading cause of death among people aged 65 and older. 73% usually are 75 and older. Look at that. 1 in 3 older Americans dies with Alzheimer's or another dementia. It kills more than breast cancer and prostate cancer combined. And in Orange County, where we're at, 65 and older is the only growing demographic. So not even in the world, not even in the US, right here at home, 65 and older, it's going to be big question marks. Now, on the other side, as a doctor, for example, I'm a PCP, what they call primary care provider. More than 25% of doctors report being only sometimes comfortable when patients ask about Alzheimer's. So imagine, a doctor not knowing what to do. 50% did not feel prepared. This is very telling. Alzheimer's dangerously underdiagnosed. More than 60% of Alzheimer's cases over 65 are not diagnosed. So that is very, very concerning. Imagine as a medical community not diagnosing 60% of heart disease. Imagine missing 60% of cancer. Medicine would not exist as a field. But I don't want to leave with all those grim facts, right? There's a lot of hope. I want you to know there's so much going on in this space. I want us to touch on this huge circle. It's very overwhelming, but this is what the Alzheimer's Association creates, or they have a lot of drugs that go through the pipeline to see what's there, what's on the forefront, on the horizon for treatment. So I put a big square here. Phase 3 means is the closest to possibly being used for the population, the regular population. So interestingly, if you look carefully, metformin is being studied, omega-3. Look at that, caffeine, interestingly enough, even though that affects your sleep sometimes, can be used for mind. You kind of push outside. So CBD, cannabidiol, nicotine actually is being studied. So there's a lot of promise right now for things we were already using in the past, now we can say, hey, maybe it can be also used for dementia and Alzheimer's. Luckily, we're starting to find a way to create a proper structure on how to diagnose and treat, right? So primary care, you want to ask the questions. Look at all these testing. There's so much testing going on. It's actually really great. Blood tests. We have a lot of more specific blood tests that can actually track plaque buildup. And of course, treatments. Like I said, treatments from the previous page, we're getting there. And this was released by Lancet for 2024. So I want to go over this real quickly. This shows about 40 to 45% of Alzheimer's or dementia is modifiable. That means it's in your hands. So I always try to empower my patients to help themselves. So this is a little tough if, for less education. But if you look at midlife, look at all these things. LDL, depression, physical inactivity, diabetes, smoking, hypertension, obesity, alcohol. Look how much percentage you can actually improve or decrease your chance of getting memory issues if you kind of control these things. For those who have hearing problems or hearing loss in the audience, please get your hearing checked. I cannot stress that enough. I know it might be, maybe the husband doesn't want to get it done. Usually the wives complain to me and say, tell my husband to get their hearing checked. There's a reason. 7%, that's pretty big. So imagine decreasing your chance of getting dementia by almost 7 to 10% if you just fix your hearing. As we get later on in life, socially isolating yourself can affect your memory. Air pollution, small percentage. Visual loss. So if interestingly, vision, hearing, those two connected, right? Our brains are meant to be stimulated. So the whole point is a lot of the power is in your hands, okay? So we're about to wrap up. I hope this was a good lecture for you. I hope this wasn't you during my lecture. Hopefully you were awake. All right. And I just want to, let's see, last thing. Want to wish you all a happy Thanksgiving. Hope you guys all have a lovely time with your friends and your family and your loved ones. And real quickly, if anybody has questions or concerns about dementia and Alzheimer's, Alzheimer's Orange County, alzoc.org. What a wonderful organization. A lot of resources help support. There's a lot of different websites here. alz.org, alzheimers.gov for clinical trials. This is California's Department of Public Health website. And then UCI Mind Clinic, also very big. So in Orange County, we have a lot of support, right? This is our number if you'd like to call us anytime. Okay, we have a Facebook group as well, ALZOC, and then our website here. And I just want to leave you with letting you know, right? Sleep is so important. And even with memory, I want you to know you're not alone. We're here to help you. I never want you to feel you're not supported. Okay. So if any of you have questions, you can reach out to me. This is my office number and my email and my website. All right. Thank you. So let's see. I'm gonna look at the chat. If anybody have questions now, let's take a look.
We have a lot of questions. Thank you so much, Dr. Patel, for all that wonderful information.
Yes.
If anybody has questions, please put it into the chat box. There were several questions we had. So one person asked, what is your opinion of the mouth patches that force breathing through the nose during rest?
Yeah, so I've seen those. I'm looking at the chat box. So Diane, so for those with the mouth patch, I'm open to it, right? Like when it comes to sleep, like I said, my personal philosophy, less pills, less supplements, the better. The fewer things you put into your body, it's always better. So I've had a few patients who've tried, there's some like, what's a hostage tape or something? Somebody created something where you duct tape literally your mouth. So apparently that forces your nose to stay open. So I'm open to it. Another one of my patients wears like a nasal strip sometimes, and that can help open their nasal airways as well. Right. And let me see the rest. Let's see. Yes, getting ready to do my sleep study with the Navy. Yeah. Okay, Emily, that's good. So I saw that Lynn said she was wearing or using a CPAP for a year, lost weight. Interesting. Yeah. So air blow. Yeah. So you may want to check your the machine. Sometimes they can be not sealed, right? There's different options as well. Now, how effective is Inspire? Great question by Bonnie. So yes, it is actually quite effective, right? Because all treatments are meant just to open that tongue, right? Once that tongue is open, your airway is open, you're good to go. now that pacemaker usually lasts, I think like the battery is about 10 years, like the typical pacemaker. So the issue is you may need to have to go back and get the battery replaced. Surgery, I see a question here about surgery. They literally cut. If you look at the back of your throat, you have a little thing hanging out at the in the middle. It's called the uvula. So what they do is they literally cut that out to try to increase your airway space. I don't recommend you cutting around in your mouth if you don't have to. So I don't really recommend that. It's not that effective. So for people who don't sleep on their back, Leticia said it's hard, right? Some people can wear a CPAP machine when they are sleeping on their sides. So sometimes that is an option, but honestly, you have to adjust. It's tough. I have a lot of patients that don't like the sleep study. They don't like the sleep apnea machine. But all I know is for patients who wear it, they feel like a completely different person. And they tell me like, I love my CPAP. I would, I don't know what I would do if I didn't have it. Okay. And then, let's see, 10 milligrams. Yeah, I see that. So trazodone, yeah, Claudia, there's some doctors that say trazodone makes Alzheimer's worse. But remember, the idea is to sleep or not to sleep. So would I rather say don't take a medicine and good luck with sleep and maybe you suffer with insomnia, or just take something so you can sleep? All right. So I usually steer towards anything that can help my patients sleep, basically. Okay. And then Diane asks, can you force yourself to get more sleep? I don't know if you can really force yourself. It's like habits. It's like, why do we brush every day? Right? Why don't we just wait till we get cavities? The same concept. Why don't we sleep every day on a routine? You have to train. Your brain, your mind, your body are very trainable. We just have to do the work to train them. And then let me see. Okay, let's see. Let me see what else. Okay, great. Let's see if there's any other questions here. What the name of the device? Okay, so Smart Nora for Claudia. So Smart Nora is something you can get online, like a thing that lifts your pillow up. The Philips device, I forget the name, but you can type in Philips sleep apnea device and it'll show up. For the website for binaural beats, honestly, you just YouTube binaural beats for sleep, and literally it'll show up a bunch of stuff. It's pretty easy to find, actually. And then yeah, they don't allow you to sleep much during a sleep study. Yeah, that's the problem. Sleep study is not very realistic in a sense. And then if dream sleep is not the most restful, is there anything you can do if you feel like you dream a lot? And let's see. So let me see Krista's question. If dream sleep is not the most restful sleep, is there anything you can do if you feel like you dream a lot and as a result are not waking up rested? Yeah, technology is, a gift and a curse, right? So a lot of new tech companies, they have bands, the Whoop, like I mentioned, Apple, you can actually track different parts of your sleep. Some of these, like there's a Friends band, Frenz. Sometimes you can wear it. It can help your sleep, but sometimes it vibrates. They can kind of knock you out of what stage you're in if they think it's not healthy or not appropriate. Right. And then let me see, I can put in the website here. My brother, too hard to sleep, 6 hours. She does not call. So yeah, I say my brother's daughter is 2 years old. She from Sonal hardly sleeps. She's not big cold or cough. How can we take care of it? So yeah, it's tricky. So you may want to check and see if there is something going on. If she has some sleep issues, then the same thing. You really want to train. The daughter is hard at 2, right? They're all over. They do what they want, but you want to create the proper habits, right? Like you have to sleep early to make your kids sleep early. You may need to do like a massage. Have to calm them down. So it's the same thing. I have some patients who give their kids melatonin. I don't recommend that either if you can avoid it. Right? Husband to sleep, they didn't allow him to sleep much. Yeah. So yeah. So basically, like I said, when it comes to sleep, you do whatever it takes. Okay. Because it's that important in terms of controlling it and, being on top of it. Definitely want to be on top of it. If you have any issues, please go to your doctor. You can call me, but take care of it because it can affect everything. Right. So real quickly, let me see. I'll put in a YouTube. Let me see if I can just type in something real quickly for YouTube for binaural beats so you guys can use that. I literally just type in binaural beats for sleep. That's literally it, and it should come up. All right, I'll just put something in here. All right. So delta waves are like, look at this. One of these have 40 million people. So clearly a lot of people are listening in. All right, so I'll put that in. So you can kind of check this out. Oops, let's see, that didn't work. All right, so that's one. So you can just click on this. Now it's recommended you wear earphones, not headphones, not on your speaker or your iPhone. Keep it in your ear, and that can definitely help. And then the last thing, the Smart Nora. Yeah, it's pretty cool. I'll put that in the chat as well. So that is their website, smartnora.com. Yeah. So good. So yeah, that was the gist of it. Like I said, I have my information here. If you guys want to email me or call our office, if you can see me if you need to get checked out. But yeah, please reach out if any other questions come up. I really hope all of you have a happy Thanksgiving.
Bye, everybody. Have a great Thanksgiving.
All right. Thank you.